Welcome back, everyone. Well, you know, if you're trapped in the cycle of poverty, it becomes very hopeless sometimes. A lot of challenges. And what really adds to that is the fact that while there are support systems out there, it's so hard to navigate which organization does what, is it for me, how do I contact them, what do I do? Well, we have a very interesting organization right in the heart of our viewing area called the Adirondack Health Institute. And joining me today is the CEO, Margaret Vosberg. Welcome, Margaret.
Thank you.
Very nice to have you here.
Thank you.
You know, in the conversation we were having before we went on air, that's the thing that really stuck in my mind, is that you're bringing, through the Institute and organization and your partners, you're supplying necessities on a number of different areas for people, let's just say, less fortunate than we are.
Right.
Right? I'm going to start by asking you a question. This is very closely linked to the Medicaid program, and why is that?
Well, because we're fortunate enough in New York State to have a Medicaid waiver, and it's a program that allows us to really transform healthcare. And that doesn't mean just disease. It means looking at the social determinants, the things within a person's life in our society that inhibit them from reaching their potential. And we focus on the Medicaid program because New York State has gotten into a DSRIP waiver through the vision of Governor Cuomo and the work that regional teams have undertaken to really transform healthcare. And finally, it's a broad enough definition of healthcare that it doesn't mean just illness prevention.
Yes, right.
It means looking at how to help people stay healthy and reach their full potential. So health means having a place to live. It means having enough food. It means having some hope and the ability to become independent and to be able to live your own life. And we're fortunate in that we really are an outgrowth of the initiative of Dr. John Ruggie, who 29 years ago started initiatives to bring healthcare to the Adirondacks. And that means primary care.
You know, this feeds on itself, a sense of poverty or, loss of hope. And that, I love the idea that, Margaret, in this Adirondack Health Institute, that the word health, as you just said, doesn't just relate to, hey, I've got a cold, I need to take some aspirin. You know, when I asked Margaret what the priorities were, things like mental health came up, addiction came up, education came up. So it'd be my guess that there will be a lot of organizations that you partner with. It's a very complicated world. Your mission is to identify those organizations for the needs of that individual.
Correct. And
then try to create a path for them to get that assistance.
Right.
So give me an idea of the partners.
Well, they're community-based organizations. It could be county mental health agencies, it can be visiting nurses associations, it can be nursing homes. It's the entire gamut, anyone that would touch the life of a person in need. We're bringing in the schools because so much of this, if you're talking about prevention, it has to do with education.
Right,
so
sure
it's the opportunity to bring all of these incredibly talented people together to identify the needs of a specific population and then to work with them in the same cohort. So we have physicians, we have hospice programs, we have visiting nurses associations sitting down together and saying, all right, these are our goals. These are the problems we've identified. How do we work together and put a network, a community network together so the patients, they're not patients, they're people that have needs. We're hoping that they're not going to become patients.
Yes, right.
So it's an amazing, it's a way of getting all of this synergy and bringing it together and focusing it. And that's what AHI does.
Yeah, it's such an incredible task. You know, I asked Margaret, what would be the top priority here? And she said, taking care of people. And you think about that, you know, it is very fortunate we live in the Adirondack Park, but when Roosevelt established the Adirondack Park, part of that was preserving its natural state, which means that it doesn't attract a lot of industry.
Correct.
All you have to do is drive around in the Adirondacks any given day, and you'll see a lot of very rural communities that are struggling to make it. Okay, you lose your job. There starts the multiple.
Right.
You're not eating properly. You're not taking the medications properly. Your children are not being educated well enough. You don't have proper transportation. You see, it just feeds on itself, doesn't it?
It does. And our job now is to break the cycle.
Yeah, right. Got it. Well, what a task. What a mission.
I know. It is a mission. And the people that we attract are mission-driven.
Yeah, sure.
Very clearly.
Well, you know, much like yourself, I have to tell you, Margaret is new to this position, having a wonderful career in the medical industry. She decided 4 months ago to take this position on. Her comment, when I asked her about it, was very interesting. She said, I just didn't feel I could do enough for people. And granted, let's face it, if someone is down to the point where the only recourse they have, because they don't have a car, they don't have transportation, they don't have anything, is to go to the emergency room.
Right.
Right? Then they're treated and they're let go.
Right. With no follow-up.
Yes, right.
So it's just a vicious cycle. And
Right.
we're here to break that cycle.
Right. Oh, isn't that something? Look, what I want to make you first aware of is the organization, Adirondack Health Institute. And let's face it, if you know someone, it's yourself, it could be your family, it could be your parents, it could be friends, it could be someone that suffered an accident, we were talking about that as well, that just having trouble getting on their feet, and if that's their priority, understanding the complexity of our system and all these organizations just compounds it, and those people become defeated. So if you know somebody, contact the Adirondack Health Institute. It's ahihealth.org. If you don't have access to the internet or the person doesn't have access, the phone number is area code 518-480-0111. Usually option 2 or option 3 will get you right in to someone who can speak to you about where you should be steered for your specific need. Well, we can't wait to have you back again.
Thank you, Jesse.
Give us updates on what's going on. And please, you know, we live in a very chaotic time for sure. But let's take advantage of the services that are there. You know, I think it's quite bold of the governor and his organization to recognize this as a priority.
Right. Might I say that the Department of Health is an equal partner with us.
Yes.
I feel like they're there for us, and they're rooting for us, and they're helping us be successful. So it's a good partnership.
And I don't think it exists in every state, by the way, so I think we're very fortunate here. And we do live in the Adirondack Park. Adirondack Health Institute. Very nice to meet you, Margaret.
You as
Thank you
well.
so much
Thank
for
you.
coming in.
Thank you.
Very nice to learn about this organization.
That's fun.
Okay, see this interview again, you can head to our website, looktvonline.com.